Hello, very good morning to everyone. Can everyone hear me?
Yeah.
Yeah, okay. Yeah, very good morning and welcome you all to this very special program that is sponsored by Handi-Care International. It comes under our holistic wellness program, which started back in April. And this is our 30th program. And we are very proud and honored to have Dr. Arun Chokalingam present this great topic about public health during this COVID times. It's for everyone, seniors and everyone else also. Now I invite Mr. Kalyan Sundaram, who is also a board member at Handi-Care International, to introduce Dr. Arun Chokalingam. By the way, my name is Sulo Krishnamurthy. I'm the president of Handi-Care International. So back to Mr. Kalyan Sundaram.
Hello, good morning. Let me see. Am I on mute?
Oh, you're fine. You're fine.
Okay. Good morning to everybody. Thank you for joining the session today. It's my great pleasure and privilege to introduce Dr. Arun Chokalingam, whom I had the pleasure of working with and knowing for the past 6 years in the context of a few healthcare conferences that we have organized, as well as several other initiatives of common interest. Dr. Arun Chokalingam is a graduate of the Gindi College of Engineering in Madras, then Indian Institute of Technology, Madras, and then Memorial University in Newfoundland, where there is undergraduate, graduate, and PhDs respectively. He is a professor of medicine and global health at the University of Toronto and founding director of global health at the National Heart, Lung, and Blood Institute of the US National Institute of Health, NIH. He's passionate about global health research, particularly on the prevention of non-communicable diseases and their control in low and middle income countries. He has established research collaborations in all 6 continents, including China and India. His multidisciplinary research interests beyond cardiovascular health include household air pollution, mental health, congruency of health, agriculture, and economics, as well as smart villages. He has published more than 175 papers. He has served as an editorial board member and reviewer for numerous journals. He's also an executive editor for the International Journal for Non-Communicable Diseases, and he has organized several national and international conferences in Canada and abroad, including an upcoming one on non-communicable diseases in 2023. He is a co-editor of the book Smart Villages, Bridging the Global Urban-Rural Divide, recently published by Springer, and as well as several other publications. It's my great pleasure once again on behalf of Handi-Care International to introduce Dr. Arun Chokalingam. Dr. Arun, over to you.
Good morning. Vanakkam. Katthadanal Aya Painankol Valarivan Nashal Tolarenin. That's a Tirukural. With that, I just pray to God for the well-being of everybody. And I want to thank Handi-Care for this opportunity to communicate with all of you, to share some of the knowledge. Many of them are public, and that's what I'll be talking to you. But what is public health and why it is important? But before I do that, let me also recognize the Orange Day today and its significance. And it's a time for us to rethink and then to reconcile. So let me share my screen. So public health for seniors and everyone during COVID-19, that's what I was asked to speak. So let's first find out what public health is. What is public health? The definition of public health is it's a branch of medicine dealing with public health, including hygiene, epidemiology, and disease prevention. And the second definition is, this is the health of population as a whole, especially as a subject of government regulations and support. I'm sure most of you are quite familiar during these COVID days that the second definition applies very much. So let's see what are all the possibilities of public health. What are the applications of public health? Public health mainly deals with infectious disease, that is the conception. But that is not true. I'll come to it in a few minutes. Public health was the issue when the initial pandemics broke out about hundreds of years ago. If you want to prevent cholera, then you have got to make sure that there is no slump of water or anything, so that you can prevent the malaria, cholera, and all those things. So that means it is not the individual health alone, it is the entire public's health. So when the pandemics broke out, you have got to control the pandemic. That means every public needs to cooperate. So this is what we are seeing right now in COVID-19 conditions. And public health also deals with chronic diseases such as cardiovascular disease, cancer, diabetes, respiratory disease, and even mental health, I would say. So why? Why is it a public health? See, during cardiovascular, the heart disease do not occur on its own. Yes, there is genetic component to it, but genetic is only 20%, while 80% is due to environment. If people around you are smoking, then you end up smoking that polluted air. So it affects your lungs. It affects your circulatory system. And likewise, if we don't eat proper food, if the food that we get in the supermarket is highly polluted, and of course they wash and they make it shine so that we get attracted and buy it, and the amount of pesticides that goes into it. So these are all of public concern. So that's part of the public. Diabetes mellitus. Yes, when I was growing up as a child, if there's one sweet shop somewhere in the corner, then that is a great thing. But right now you go to any city in India, so there's hundreds of sweet stalls. So people are loaded with sugar. So it may be tasty for that few minutes, but its effect on the health is much worse. So these are all some of the public health concerns. And then food security. And we see a lot more people being obese. Obesity is a risk factor for heart disease, cancer, diabetes, and everything. So obesity is not a common occurrence. It is due to our lifestyle management. And health security. And if we don't have proper lifestyle, then that compromises our health security. And then, of course, public policy. When the road accidents were occurring a lot, the simple public policy of seat belt that saved many lives. And likewise, water fluoridation to prevent any infections going through the body. So public health comprises of everything that you talk about. It talks about right from you get up in the morning, you go brush your teeth. So sometimes your dentist advises you to brush your teeth for 2 minutes to make sure that you check every part of your mouth, every part of your teeth. So that is a public health message. So, and then you go on your work, and then even sleeping for about say 68 hours, that is necessary for your good health. So these are all public health measures. So public health is beyond COVID-19, but for the purpose of today's talk, we will look at COVID-19 because that is of much interest to most of you and every one of us, because that has locked us up for almost 18 months. And we still have not won the war yet. So this is something you all must have seen, the COVID-19 dashboard. So you can just go onto the internet and see how the COVID is present throughout the world, which country is having more, which country is having less. and where does it occur. So there are several sites, several government sites. So this one I picked up from the Johns Hopkins Coronavirus Resource Center. So you have got multiple ways to look at it. So it tells you the total number of cases on the left-hand corner. And then just below that, it also gives you the 28-day cases. See, the idea is that you want to see whether the COVID has gone up or gone down. And likewise, on the second one, on the white mark, it says the total number of deaths. So it's unfortunate, close to 4.75 million people have died due to this invisible infectious disease. And just in the last 28 days, over 250,000 people have died. So in the initial stages, in the first 6 months, 7 months, or even 8 months, we did not have any solution to save ourselves. But the science has worked very hard, and authorities have also cooperated, and we have some predictive vaccines which are trying to help people from suffering or dying. So right now, over 6 billion doses of vaccines have been put on the shoulders of people in the world. But that is not enough. Looking at, say, 7 billion people on this planet and only 6 billion doses, that is not quite adequate. So the COVID-19 dashboard, you can always look at it and you can learn more about it. Let's come to Canada. So what is the Canada situation? As of September 29th, that is yesterday, we had nearly 1.5 million cases throughout Canada. And some of the larger provinces with a larger number of people have more cases. And always there are some exceptions. And smaller provinces like Alberta and Saskatchewan are even contributing much more on a per capita basis. And this is all about the number of cases. What about the deaths? And we have lost about, say, 27,600 lives in Canada in the last 18 months just because of COVID. And this is one single factor that has cost so many lives. Now, is it the effect of just the COVID? Yes, this is the numbers due to COVID. But COVID-related non-availability of services, that costs even more. Many of the scheduled programs in the hospital, due to chronic conditions like heart attack and cancer, these people don't get an access to go to the hospitals to get their treatments done. So there is a large backlog of elective surgeries and scheduled surgeries. And this again leads to many people dying. So this is not just the COVID alone, COVID and its impact on everything else. And because of COVID and the lockdown, many of us have been inside the house, not being able to see our loved ones. And that compromises our mental wellness. So the consequences of this tiny insect, which is totally invisible, is much more than one can imagine. And if you want to beat this out, every one of us have got to be responsible. And that comes under public health and public responsibility. And initially we were dealing with the main COVID, and you all know about the shape and the crown and so on. And then as we find more and more ways to protect people, this particular infection is getting smarter. It is taking different variant forms, different avatars. It came as an alpha variant, beta variant, gamma variant, and the most recent one is a delta variant. And the infectious disease experts are saying that there is a potential for epsilon, delta, and so many other variables. So they are going by the Greek alphabet, alpha, beta, gamma, delta, epsilon, and so on. So each one is getting more and more potent than the previous version. So that means we have to find solutions to protect the population from being affected. And the effect of these variants increases the disease spread and the disease severity and the test used to detect the virus. So if we know the RT-PCR is good to detect it, and the vaccines and treatment, we have got to be more innovative. So in terms of vaccination, Canada has done a fantastic job. So this is a number as of September 18th, but the numbers have gone up. I'll show you in the next slide. In the next few slides, you will see where Canada stands with respect to the global situation. And we all need the Prime Minister, who is very supportive and made sure that everybody gets vaccination. The one person who really worked day and night to get the vaccine for the Canadians is Minister Anita Anand, a proud Indian heritage. And I know Anita was spending more hours every morning and evening speaking to the manufacturers to ensure Canada gets its share or the required amount of doses. So this is another important factor that we rolling averages. So if you can look on the left-hand side, you have got the Canadian data, and then for comparison, I put Ontario data here. The reporting data is on the x-axis, and then right from April 20th, you can see the rise. You can see the rise in the cases going up, and then it came down due to when September high peak. This is when the first and second variants came, and then we tried to control that, and then the vaccines came around this time, and everybody has got the vaccination. Vaccination came down. Then the next variant comes and it went up. And then now we are here in July, and then the Delta variant, sometimes it's called as Indian variant. I don't know why it is, the Indian variant. And because of that, now we are seeing the continuous rise. And there is a turning point now. And I hope we can bring this down all the way down. So corresponding variation in Ontario, you can see, and the dates almost match. So here is a global vaccination rate. On the top is G7 countries. Then in the bottom, I've got India. Canada has got 72% of the population fully vaccinated. That is about, say, 2 doses. And partially vaccinated about, say, 78%. It is not because Canada does not want to vaccinate everybody. There is a group of people who are trying to abstain themselves from taking vaccination. It is their personal conviction. It is unfortunate that they have chosen to be that, but the vaccinations prove to be protective. When compared to UK, Germany, France, Japan, USA, which is 56% fully vaccinated, in spite of the fact that they are producing a lot more vaccinations there. Australia is around 43%. Comparatively, among the G7 countries, Canada is the leading light. Now, we are all back from India, so we would like to see what the rates in India is. In India, the fully vaccinated people are 17%, and partially vaccinated is about, say, 47%. So a lot more work needs to be done. The interesting statistics, globally, the first place with 84% fully vaccinated countries are United Arab Emirates, the Dubai and area, Portugal, and Malta. These are smaller countries, but they have achieved much better.
Dr. Chokalingam, can you please move to the next slide? We don't see it.
Oh.
No, it's the same slide.
I'm still speaking on same slide at the bottom, yeah. Canada holds the 11th place globally and first among the G7 countries. And what is the effect of vaccine? The proof of the pudding is the number of cases, the number of hospitalization, and the number of deaths. You can see this chart. On the first one, on the left side column, those who have been unvaccinated, they have got about a large numbers when compared to those who have either partially vaccinated or totally vaccinated, or those who are vaccinated, but the vaccination effect of 14 days has not reached yet. So that is the case is not yet protected is the one within the 14 days of vaccination. So as you can nicely see, either for the cases or for hospitalization or the deaths, the number of people who are dying with 2 vaccinations is much, much less when compared to those who have not been vaccinated. So the vaccination has got its effect. So if at all anything, I'm sure most of you have got vaccinated. If any of your friends, families who are resisting to take vaccination, please advise them, please convince them. It is their own protection. The more people get vaccinated, the more of us will be safe. And it is a collective effort, and it is a public health measure. Now, you must be turning around and asking, we hear about a third dose, the booster dose, do we need it? Well, the US has instituted the third dose, and this is their algorithm, how they go about to give the booster dose. The first question is, did you have your last dose more than 6 months ago? If the answer is yes, then are you over 65? So they would like to protect the seniors. And if it is yes, you will get the booster shot. And going back to the left box, and if it is no, it is not time. If it is no, then the question is, are you 18 to 64? And if it is so, are you in a high risk group, such as underlying conditions due to any of the chronic diseases, or moderate to severe asthma, or immunocompromised? Or if you are a high risk infection at work, like healthcare workers, or teachers, or daycare staff, or grocery workers, or homeless shelter staff, or prison staff, then you get the priority and you can get a booster dose. If it is not, then you are not eligible and wait till your turn. So you will have the same question, what is happening in Canada? Maybe we can discuss during the discussion. And moving on to the next one. And this is the herd immunity. I'm sure most of you are aware about herd immunity. In the first panel, and herd immunity is also called by different names, by population immunity, community immunity, or mass immunity. They all mean the same thing. So it is all based on the rate of infection or the R naught. See, imagine in a population, there's only 1 or 2 who have the infection and nobody else has got any protection. So this is the situation what happened in Wuhan back in December 2019, when the infection broke out. Nobody was protected. And those 2 infections led Two, within a very short time, many people having infection. The red character shows not immunized, but infected. And the yellow one is immunized and protected. Green one is not immunized and not infected or in the public. Now, if some people have got immunization, then the rate of infection comes down because, first of all, those people don't get COVID or the infection, and they are not going to spread either. And then when a lot more people get immunized and a lot more people get immune to the disease, either through immunization or having suffered and survived COVID, then they won't be passing on more infection. So that means then the outcome is much less. So this is what we call as the herd immunity, and this is what we are trying to achieve. If more people get immunized, then the chances of protecting people from COVID is much higher. So I'm coming towards the end of my talk. Public health measures: follow strict COVID-19 protocols. No matter what, even if you have got 2 doses, please wear mask in public. Wash hands thoroughly. Maintain social distancing. It is better to be safe rather than sorry. Take vaccination. Lead an active life. Don't be sedentary. Eat healthy, nutritious foods. Be vigilant about COVID-19. Promote public health messages. If every one of us can do it, I think we can win this war against COVID. So I will open up for Q&A, but before that, Slochana Krishnamurti has got some message to talk to you. Thank you. Thank you for the opportunity.
Can you please close your window, Dr. Chokalingam? Okay. 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 Hello, everyone. I'll save my vote of thanks to the end of the program after the question and answer period is over. The message I want to convey to all of you is Handi-Care International and this COVID are very much interconnected because for those of you who do not know about Handi-Care International, it's a Canadian registered charity formed 30 years ago, and we have focused mainly in rural India and focused on children and youth with severe disabilities, including we started with physical disabilities and we have moved on to mental problems, including cerebral palsy, autism, and all those things. So currently we have more than 3,000 children in the early intervention program. I'm going to share the screen with you. Before I share the screen, I just want to tell you, this impact of COVID-19 on our program is tremendous in the sense these children and youth and adults with disabilities who are in wheelchairs, they need caregivers, and the caregivers are, even though they are double vaccinated and things, they cannot maintain the distance, and they have to be in close contact with the patients. So under those circumstances, they are very, very high risk people. So we have been promoting COVID prevention measures. We have raised some money and we have distributed all kinds of protective gears for those families, and all that is happening. Since all of us are from India and we have a vested interest in seeing the success of our programs, now what we have is currently, I told you we have more than 3,000 children in the early intervention program. And the early intervention program is for children below the age 10. And they receive all kinds of rehabilitation and empowerment. so they can be enrolled into schools and they cause less burden to the family. And we also have a huge assistive device program. We try to provide the wheelchairs and walkers and stability equipment for most of these children. So currently we have a campaign called Sponsor 100 Children for this year. So the Sponsor 100 Children, it is, if you visit our website, our website is www.handicareintl.org. I think you can see it on top, handicareintl.org. And then under our sponsorship program, we have many children to be sponsored. Several people, we have more than 300 children sponsored under any one of these programs. Like a 7-year grant is $2,500, yearly is $400, and monthly is $35. That covers everything. Home visits to the children's houses and therapy, whatever kind of therapy they need. And you can see these children, this particular boy has cerebral palsy, and this boy has a locomotor disability and spinal muscular dystrophy, and all these kinds of problems. And they are from very poor areas. So the families cannot afford any private therapies or anything. So we offer all this free of charge to them, but we request you to support us. So by going into our website on the very top, we have this, and you can sponsor a child, and then that will go to the Sponsor Me page again. And you can select a child, and then after selecting a child, it'll guide you to a form. You can fill it up and sign up. We would very, very much appreciate and request your support on this so we can reach our target for this year. This is an ongoing program, and we have had great success. We started it, this particular initiative we started 5 years ago, and we already have discharged 600 children. Discharged means they have gone back to their homes, being taken care of by their own mothers, and they are enrolled into schools and they are studying, and they are still getting help from us, but they are more or less empowered and independent. All this has been possible because of our donors, and I request all of you to take a look at this. I brought this up to show it to you because it's very connected with the topic Dr. Chokalingam is presenting today, how this COVID, even though it's affecting every one of us, but it's affecting the disabled population in multiple ways, much more than what we can go through, especially in rural India, where hygiene and sanitations are poor and the working conditions are poor. And so this is where my request is. And thank you all very much for indulging and listening to me. Now back to Dr. Chokalingam. You can post your questions or you can raise your hand and I will unmute you. I'll ask you to unmute and you can ask your question. Thank you so much, everyone.
Thank you Sulochana ji. I will start the question. I will have the first question. Dr. Chokalingam, over the past 18-20 months, there's been a tremendous change in the lifestyle behaviors of all of us because of COVID-19. Over the last few months, almost all of us have had our COVID shots, the first shot and then the second shot. And even now we have a wide variance among the behaviors of people. There are many right now, even after they have had their second shots, they are still very much afraid to venture out of their house. In fact, they hardly ever get out of their house. On the other hand, there are people who have said, I had my 2 shots, I can just go do whatever I want, wherever I want, I don't have to wear a mask. So we have both extremes. So what is your suggestion and what is your advice for people, especially seniors, but also for other people, as to what kind of lifestyle behaviors that they should be adopting at this point, having been doubly vaccinated? Yeah, over to you.
All right, this is quite a loaded question, Kalyan. Let me try to unravel and then start answering parts and pieces of your questions. Yeah, number one, when some of the seniors and people are afraid to go out, after 2 vaccination, I can understand their apprehension. Because initial stages you have been locked up and you think by staying inside the house you are protected. But that protection has been provided to everyone with the 2 COVID shots. So those 2 vaccinations should protect you, if nothing else, at least for 8 months. At least for 8 months, the vaccination effect will be there, and you can move out, but not to a very large extent and then going into parties or anything. But go for it, and when you are there, maintain social distancing, protect yourself with a mask, and we cannot be staying inside the house all the time. You have to meet your loved ones. You've got to go for your family functions. Yes, go for it, but protect yourself with common sense. Now, with respect to people saying, yes, I've taken the vaccinations and I can be careless, I can go anywhere. My caution is, please behave yourself, and you are not compromising only yourself, but you're also compromising the public. So that's my advice.
Thank you. Thank you. There's one more question that came on chat from Mr. Sharath. I'm just going to read it out to you.
Yeah, I read this question.
Okay. So you can respond. No problem.
So I think what he is asking is absolutely right. I think that is what the Canadians are being cautious. We are not rushing into the 3rd dose. Yes, there are countries which have gone to the 3rd dose and still they have not seen the effect. So there is something called optimization. If you take something too much, then there is some consequences. So it's all based on science, but during COVID times, sometimes the science fails. But based on science, the 2 doses should be effective, at least for 8 months or 10 months. So you don't need a booster. But if you load your body with too much vaccine, then it will have its own negative consequences. So I agree with this concept of providing only to those who are vulnerable. And that is why the Canadian recommendation is only to those who are totally immunocompromised. And even that is fully accepted or fully passed by all provinces. So we are cautious.
Thank you, Dr. Chokalingam. At this point, I'd like to acknowledge the contribution by Shubh Helping Hands. They raised $5,000 towards the COVID prevention measures for Handi-Care, and it was distributed to our rural areas, and it has benefited more than 5,000 families. And thank you so much, Shubh Helping Hands. Now, back to the next questionnaire. The next question is also from Mr. Sharath. I think that has been addressed, correct?
Yes.
Okay. Okay, if anyone else has any questions, I think you will be able to unmute yourself or, oh, okay. Asha Wobrai. Asha Wobrai has a question. Can you please unmute? Okay.
Yes, good morning, doctor. My question is specifically when people are having parties indoors or they are inviting people for indoor buffet dining, we are scared to go. Are we okay in our outlook? Especially if somebody is having a 200 people indoor party?
Well, the humans are social animals. We cannot stay completely inside and then avoid everybody. So we need to go. But while you are gone to such parties, before you go, find out how many people are coming. If there's a large number, then you reserve your time and you go earlier or after so that you are not part of the crowd. But even while you're there, please wear your mask. protect yourself, protect others.
Yes, but if you're going specifically for dining out, then, I mean, you may wear the mask before and after, but even for that period of time, you would be exposed.
Yes, you will be exposed. You will be exposed. But these are some of the judgmental things that we need to make. And if the social connections that you want to make, then don't go for that gathering. Meet them before the function or after the function, so that you can have your own small bubbles. With just 5 to 10 people, you can sit at a distance and talk to each other. Then you don't need a mask while you're chatting. So a lot of it, we have got to use our common sense.
Yes, thank you, doctor. I mean, connected to that is another question. What about inviting people over to your own house, apart from the family?
Yes, if they have taken the 2 doses, and if they are going to stay with you for an extended period of time, as long as you are not very close to each other, yes, you can.
Thank you so much. Thank you.
Usha Madhivanan has a question.
I think, Usha, you can unmute, I think.
Yeah, I can.
Okay.
Hello, Dr. Arun. How are you? Arun sir.
I'm good, thanks, Ushama.
Arun sir, I want to know, you said that it is the vaccination is effective only for 8 months. So
Well,
you think that should we have it again after 8 months, or will the government tell us, or what is the procedure going to be?
Well, nobody knows what is the half-life of these vaccines yet.
Oh, okay.
The science is being still studied.
Okay.
But Americans are always aggressive. That is why they said, if you have got last 6 months, then go for it.
Okay.
But its effect is even longer than that. But again, we have got 6 different kinds of vaccines. We do not know what is the half-life of each of these vaccines. When we say half-life, that is the potency of that drug lasts at least 50% over a period of time.
Okay.
And that half-life, when it goes below the half-life, then the potency is lower. So that is when you need the booster dose. See, imagine we are taking booster dose every year for flu.
Mm-hmm.
So this is another kind of flu. So who knows, in future, they might mix one injection protecting flu, COVID, and all the other infections.
Okay.
The science is under development.
Okay. Thank you so much, Arun sir.
I'm looking at a question from Sharad, and he is looking at the children below the age of 20 and the health condition. How does it justify vaccinating 8 million kids where we don't have long-term studies? Yes, we don't have long-term studies. We cannot sacrifice people for long-term and to see whether the vaccine works or not. And if we have been waiting for long-term studies, we would not have any vaccine even for the adults. So at times, people have to take a chance in the best interest of the larger public.
Yeah, thanks, Doctor. Yeah, I can understand that for adults. Again, for kids, if you see the data, there is only 16 kids. Again, we don't know the underlying conditions. And there's been several adverse reactions being reported, including heart inflammation, myocarditis among the teen. So does that still, I am concerned to vaccinate my younger kids.
No, I fully appreciate your concern, and everyone should be concerned. But don't forget, kids also they will be the carriers for vaccine for COVID. They go to schools. When they come back home, they could still carry the infection, and that could compromise the people at home. But that is why the kids have not been vaccinated in the first round, and the studies are still going on. And we might, I'm not saying we are ready, we might get some vaccination soon for the children.
Yeah, that's where my concern is. Like even the vaccinated are getting contracted and passing, so it's not really stopping from passing the virus even among the vaccinated population, right? So
Yes, but the thing is that as you have seen in one of those slides, you saw the histogram. Those who have vaccinated have less chances of being hospitalized or being subject to death. So the protection is high with vaccination. So it is all an evolving science. We don't have an answers for everything, but we have to work it out.
thanks, doctor.
Yeah, thank you, Arun Chokalingam. Now, I think Ms. Neena Verma has a question for you. Neena,
Yeah,
can
what
you
is that
unmute
right
yourself?
one?
Yeah, thank you, doctor. It was wonderful. And first, I would like to invite you because we have 100 to 120 seniors joining at Shubh Helping Hands, and I'm the founding director. And Sulochana ji's Handi-Care International is very close to my heart. And we have been helping. And I'm doing an indoor event because the seniors learned dance and everything. And they are going to present there, but they are all fully vaccinated. We are not letting any kids or anybody come in there. We are checking everybody. We are keeping safe distance. Is it okay? Because they want to come out near Diwali and they want to dress up and, and they want to present what they learned on Zoom. So my question is it safe? We will do it safely, but again, because they are all fully vaccinated.
Nina, as long as they are fully vaccinated, and if they're all willing to follow the COVID-19 protocols,
Yes.
behave themselves, absolutely no problem. You can invite them.
Thank you so much.
And make sure that your space is adequate to protect everyone.
We got the double space. And we are very particular because I just wanted them to come out and do, because mentally they were not sitting on Zoom for hours. So I thought this will be a big change for them to come out and do it.
I fully agree with you. And man is a social animal. I should say human. I shouldn't say man anymore.
Thank you so much. Thank you and welcome. Thank you so much for the wonderful talk. Thank you. Thank you.
I think there's another question from, I think, Meena Supaya about travel to India, advice on travel.
Meena, travel to India is safe. Travel to Chennai is safe because from what I understand from the situation in India, there are several states which have well control, especially Tamil Nadu has got a very good control, and they have got more people vaccinated. And still, the COVID protocol for people like us going from here, we need to maintain that safety precautions. Let us not let the guards down. And I would still request people traveling, please do wear your masks. And no matter what others say, well, we are not wearing masks, why are you wearing masks? And that is their choice. But we have a choice to wear masks, and we can.
Dr. Chokalingam, along the same lines.
Thank you.
Yeah, thank you, Meena. Along the same lines, people, even though India or Chennai could be safe as safe as Toronto, but the traveling, the transit itself, the travel period while we are confined in the airplane and using the same washroom as everyone else, and removing our mask during meal times, that is all posing a high risk. And I know of a few people who were tested negative before leaving India, but after arrival, they came out with full-fledged COVID, and they suffered a lot. So how could they protect themselves during this travel period?
Well, all that I can say is wear your mask as much as possible. And while you're eating, you cannot avoid, you have got to open the mask and eat it. But other times, try and wear as much as possible. But we have to make a compromise, whether to take a chance and go home and see the loved ones, or protect our own health and then stay back and not see them at all and see them only through virtual realities. So at times we take risk in life. So like anything else. So the risk and the benefit, you have got to look at the equation.
Okay, thank you. And also the other precautions like sanitizing your hands and not touching your face, those things would help, right?
It is hard. It is hard. You watch yourself, how many times without we realizing ourselves, automatically our hands go to the face or to mouth or to nose without we realizing it. In spite of being so conscientious, still it happens. So it's a practice over time.
Okay, thank you, Dr. Chokalingam. Does anyone have any other questions?
Yeah, maybe Dr. Chokalingam, you can shed some your thoughts or your expertise on people with other, the non-communicable diseases like diabetes and all that. What should their behavior be specifically, if, in comparison to others who may not be suffering from those illnesses?
Well, whether you have got a condition or not, still eating healthy and being active goes a long way, whether it is COVID or not. But those who have got conditions is to be even more cautious of what they eat and where they eat and how they eat.
Thank you.
I think somebody has another question. Should seniors take pneumonia shots?
Should seniors take pneumonia shots? I think this is a question that you should ask your own physician. So you cannot have a general answer for this. So speak to your family doctor and get the proper advice, because each one's physical condition is very different.
Thank you, Dr. Chokalingam. Anything else? Anyone else?
Sulochana ji, I just want to ask a quick question that if we keep taking shots, then I'm very curious that I have already taken shots, but I'm saying we don't build immunity. How do we build our own immunity? That is also a question.
You build your immunity through two different routes. One is if someone who has got a COVID and suffered, and then they come out safely, their body starts to produce own self-immunity.
Right.
And if not, the COVID shots that you're getting it, the so-called mRNA shots or any of these
Right.
shots, they stimulate immunity inside your body, and it protects any of the external infections coming into your body being pushed away. It's more like a shielding. So the vaccines do protect and provide immunity.
Yeah.
And
Right.
if you have looked
Right. But I am always
if you have
curious
looked
that.
at that herd immunity chart.
Yeah, yes, that I really liked, because that herd immunity, that's why I thought we should go out. We did picnics. Because sitting inside for a year and a half is a big thing for seniors, especially when they're lonely and mental and they are sitting on Zoom, they are not active. They're sitting 2 hours and sometimes 8-hour sessions. They are in everywhere. So, but can you shed some light? I mean, herd immunity works or not? Like it does work, right?
Herd immunity definitely works. If you remember the cholera and the earlier pandemics about 100 years ago,
Right.
the Black Death occurred, and the humanity still survived. It is all because of herd immunity. And for us to reach the herd immunity, with COVID, the whole world has got to be vaccinated. We are
Right.
we are so fortunate in Canada. 72% of the population has got fully vaccinated. And there are countries where there is only 1% vaccination.
Yes,
And there are countries which did not even get one vaccination.
true.
So the inequity is so predominant. I think that has got to change.
Right.
And we have got to find innovative methods to produce these vaccines at a much, much, much lower cost so that
Yes.
everyone will benefit.
Yes, I agree with you, and that's what we have to do and start helping the third world countries also, like where they can't afford. And and thank you so much to Handi-Care International, because that's what. And and Kartarpur Hospital also, I'm a director, and we sent vaccines and oxygen concentrators and everything, and we are trying our best. If everyone tries and help these institutions who are genuine, honest, like Handi-Care and the Kartarpur Foundations, and don't just throw your money to anyone, right, doctor? Don't just give money to anyone. Just see if they are genuine charities.
Well, I cannot agree with you anymore. I think you said it all.
Thank you.
Thank you so much. Thank you so much, Nina. That was a wonderful insight and wonderful questions you posed. And does anyone else want to ask anything else? Or it might be time to wrap up.
I just want to add that this was a very nice and useful presentation. Nice seeing Sulochana and also Mr. Chokalingam, Dr. Chokalingam. So thank you very much. That was very useful. Yeah.
Thank you. Thank you. Okay. Okay. If there are no other questions, I'm going to wrap this up by thanking all of you for taking your time on a weekday and coming to attend this program. Also, this has been a special day in terms of our government declaring the Reconciliation Day. I managed to find an orange saree, so I wore it to show my solidarity. And that's a great move by our government, and we all support it. And I don't know how to thank Dr. Chokalingam enough for consenting to give this presentation, and which is an excellent presentation. And I learned a lot, and I'm sure everyone else learned a lot as well. And we want to have him back because he has wealth of knowledge on various topics, not only just this. So we hope to welcome him back, through the next few months, and get him to shed lights on many other topics like these. So I thank Dr. Chokalingam, and then I thank SVBF for where he is a trustee of, which has promoted this event, as well as Dr. Sadanand Mankikar for supporting and promoting this event, as well as Ms. Nina Verma through her Shubh Helping Hands, and she's doing a fabulous job bringing several very useful programs for seniors, including physiotherapy and fitness and talks on various topics, and you name it, she has them. So if you can look her up on Facebook under Shubh Helping Hands, and you can request to join her group. So I thank all of you for coming out. I thank Mr. Kalyan Sundaram for making this liaison possible, and everyone else. If I have missed anyone, that's my old age. I'm so sorry. So thank you all, and I wish you a very good rest of the day and a very, very good weekend, and hope to see you all back for our next session. Thank you.
Thank you.
Thank you, Sulochana. I just sent a message. If anybody is interested or would like to have the slides, they're welcome to have it. I can send it to Sulochana and we can share it with people.
Yeah, I'll probably post this video recording on our website, and then anyone, if you don't mind, Dr. Chokalingam, then people can go back to it and refer to it, those who have missed it.
The knowledge is to be shared.
Yes.
Thank you, everybody.
Thank you once
Thank
more.
you.
Thank you. Bye.
Thank you.
Thank you.
Thank you.
Oh, by the way, all of you, if you want to reach Dr. Chokalingam, you can send me a message through Handi-Care International. You can visit Handi-Care International at www.handicareintl.org. And you can email us. There is contact information. You can email me there. You can either show your support or if you want any further information, there is a contact information where you can email us, and I'll be happy to share Dr. Chokalingam's contact and any other questions you may have or any suggestions you may have for future programs. Thank you. Actually, the email is just info@handicareintl.org.